In general pharmacology, essential medicines, in routes of drug administration, sublingual, parenteral, their advantages and disadvantages, intravenous route, transdermal route, and special drug delivery systems is important. In pharmacokinetics, once check this, and bioavailability is important. In bioavailability, first pass metabolism, drug distribution, plasma protein binding is important. A biotransformation, prodrug, and in biotransformation, phase 1 and phase 2 reactions are important. Next, factors affecting drug metabolism. This pharmacogenetics is important. Enzyme induction, plasma half-life, zero-order kinetics, and then how various methods to prolong the duration of drug is important. In pharmacodynamics, regulation of receptors, therapeutic index is important, combined effect of drugs, and decreased response to drug antagonism is important, factors modifying drug action, and in that also accumulation effect is important, tolerance and tachyphylaxis is important, drug interaction, pharmacokinetic interactions, and then unpredictable reactions, that is adverse drug reactions is important, idiosyncrasy, iatrogenic diseases, the stable is very important, teratogenic effects, teratogenicity is important, pharmacovigilance is important, and antidotes, this is important, clinical trials is important. That's it for general pharmacology. Now autonomic pharmacology. In autonomic pharmacology, just remember that everything is important. Still some important things are cholinesters and nicotinic actions, this pilocarpa and muscarine, anticholinesterases, classification is important, mechanism of action, neostigmine, pyrrolostigmine, atroponium, drugs treating in therapeutic uses, and drugs used to treat glaucoma is important. And atropine oximes like in anticholinergic classification is important, pharmacological actions, mechanism of action, and uses, therapeutic uses is important, scopolamine is important, nicotine, skeletal muscle relaxants. Just know that you should read adverse effects and therapeutic uses. Adrenergic agonists, sympathomimetics is important. And that adrenaline, direct acting sympathomimetics, therapeutic uses of adrenaline is important. Salbutamol, dobutamine, these are important. Nasal decongestants is important. Indirect acting sympathomimetics, amphetamine, and mixer acting is important. Dopamine is important. Phenyldopamine is important. And irreversible non-selective alpha blockers is important. Reversible non-selective alpha blockers, selective alpha blockers, selective alpha adrenergic blockers, and beta blockers classification is really important. Now pharmacological properties is important, adverse effects, drug interactions, etc. Everything is important. Therapeutic uses, beta blockers is really important. Esmolol, labetalol, these are important, and differences between propranolol and atenolol, that is first generation, second generation beta blockers is important. That's about autonomic. Now coming to cardiovascular, antihypertensives, in that classification is really important. Now ACE inhibitors, adverse effects and drug interactions. Now ARB, angiotensin receptor blockers is important. Calcium channel blockers and clonidine is important. Alpha methyl dopa is important, and hypertensive crisis is important. Now, anti-anginal drugs classification is important. Mechanism of action of nitrates is important. And now, angina drugs therapeutic uses of nitrates. Calcium channel blockers. Nifedipine, amlodipine are important. Now, classification of congestive cardiac failure. Vasodilators, AC inhibitors, beta blockers. Therapeutic treatment of digoxin toxicity is important. Dopamine is important. Now, antiarrhythmic drugs classification is important. Quinidine is important. Procainamide is important. Lignocaine is important. Amiodarone is important. Verapamil and isoprenaline is also important. Drugs used in paroxysmal supraventricular tachycardia and atrial fibrillation is important. Hypolipidemic classification of these drugs is important. HMG-CoA reductase inhibitors, that is statins, is important. Bile acid binding resins is important. Fibrates is important. And plasma volume expanders, know the names, okay? Now coming to renal pharmacology. So, in renal pharmacology, diuretics is important, and thiazides is important. Adverse effects of loop diuretics, okay, and antidiuretics, know the names, that analogs, okay. Drugs acting on CNS. Benzodiazepines, barbiturates, non-benzodiazepine hypnotics, in general anesthesia. This table is really important. And thiopentane sodium, ketamine. Local anesthesia, mechanism of actions, classification is important. Methanol poisoning important. Chemical classification of anti-epileptic drugs, mechanism of action of anti-epileptic drugs, uses, adverse effects. And valproic acid, sodium valproate is important. Carbamazepine is important. Status epilepticus. Opioid analgesic classification is important. In everything, classification is really important. And differences between morphine and pethidine is important. Classification of antiparkinsonism drugs. And antipsychotics classification is important. Mechanism of action, adverse effects. This clozapine is important. Antidepressant classification is important. This table is important. Drugs for bipolar disorders. Now, autocoids and respiratory system. Histamine and antihistamines is important. Their uses, second generation histamines, and serotonin agonists and antagonists. Prophylaxis of migraine is important. Prostaglandins, this is important. The classification, preparation is important. Therapeutic uses, mechanism of action. Non-steroidal anti-inflammatory drugs and NSAIDs. Classification is important. Mechanism of action, pharmacological actions, drug interactions. Acute salicylate poisoning is important. Indomethacin is important. And selective COX-2 inhibitors, this is important. And topical NSAIDs. Drugs used in treatment of gout. Classification is really important. Respiratory system drugs used in treatment of cough. This classification is important. And bronchial asthma classification, salbutamol, the mechanism of action, drug interactions, and all those. And bye bye.